All right, time now for Aging in Style. Did you know that Masonicare in Wallingford has a 50-bed geriatric behavioral health hospital?
And you don't have to necessarily live there to take advantage of their services?
Yeah, you don't. It's open to anyone in crisis in the geriatric population. Take a look.
Hi everybody, I'm at Masonicare again in Wallingford, one of my favorite places, and normally I sing, I dance, I get hearing tests, I do a bunch of different things at Masonicare to illustrate their services. Today we're talking about a more serious topic, it's behavioral health. And I'm going to meet with Cara Carbre. She's the executive director of the center here at Masonicare. So let's get going.
Once I sit down with Cara, I know she's an individual dedicated to her profession. Today, as I just mentioned, we're talking about behavioral health, particularly one segment of the population.
I didn't realize that Masonicare had anything to do with behavioral health, but apparently it's a big part of the hospital here.
Very big. We recently expanded to 50 beds in October of 2023. Yep, all serving the geriatric population.
The hospital itself is so clean and safe, with a welcoming environment to its patients, who are only going to be here for a fairly short period of time.
What happens here? What is this facility used for?
So a lot of our patients come in from skilled nursing, assisted living. They could come from home when their behaviors are, out of control, unable to manage. We stabilize them and then discharge them as soon as we can back to where they came from.
So this is not a permanent facility
Nope.
for mental health. This is a short-term.
Yep, we are a hospital, short-term. No one stays here. Our average length of stay right now is about 26 days.
Okay, and older adults have unique needs.
Very unique needs.
Tell us a little bit about that.
Yep, so when you're dealing with an older, mature adult, they have not only their mental health issues going on, but other medical comorbidities. Hypertension, AFib, CHF, they could be dealing with chronic pain, all things that affect their behaviors. So our team is multidisciplinary. We have medical providers, psych providers. We work occupational therapy, speech, physical therapy, all to help get them back to their baseline so that we can safely discharge them.
This hospital has become even more important since COVID.
Oh yeah, absolutely. We see an increase in depression, anxiety. They, have the fear of going out, so we've seen our census increase due to that.
Who's able to use this facility? Anyone? Or?
Anyone, yep.
Okay, so you don't have to live here at Masonicare?
No, absolutely not. A lot of our referrals do come from other skilled nursing, assisted living, and emergency departments throughout the state.
Why do you think this is a particularly good place to be and to get the services that these people need?
Masonicare treats the whole patient. We work with the families, friends, conservators. We look at what's going on at home, at their facilities. Do they need a higher level of care? Our social workers really dig deep into the background so we can safely discharge them to an environment that they'll thrive in.
Some of the disorders that you guys treat?
A lot of our patients come in dementia with behavioral disturbances. So they have dementia and they may develop a UTI or something else going on, refusing meds that causes behaviors, agitation, combativeness, refusing care. We do get schizophrenics, bipolars, depression, suicidal. We really take it all.
It's got to be a pretty skilled team to be able to handle these people.
Yes, very skilled. We have many experienced behavioral health nurses, also certified nursing assistants. They both of those work together and run the floor throughout the day. We have rec therapy, which the patients love. It keeps them engaged in the milieu. It also helps with their behaviors, decreases their risk to falls. So our rec therapist is highly utilized on this unit.
I think people want to know that their family member is going to be safe here.
Mm-hmm. Absolutely, that's understandable. We are knowledgeable in how to safely, deal with combative and aggressive behavior so that both the patient nor the staff get hurt. All our staff are trained on CPI, which is crisis intervention training.
And check this out. You can reach someone here at the hospital any time of the day or night.
Here at Masonicare, our intake coordinator is on call 24/7. You can pick up the phone even if it's regarding a family member. You don't know what to do, they're starting to escalate in behaviors. You can call our intake coordinator and she can help guide you through the process, when to send mom or dad to the ED, when to bring them to the outpatient. She really is knowledgeable in what she does, and has led a lot of families, in the right direction. She can tell them where to go and where to get help.
That number to call is 860-996-2396.
Step number 2, so you need to get admitted to us. You need a doctor to say that you require our level of hospitalization. So if you're in a facility, they can get a provider there that can, sign this paperwork to get you over directly to us, skipping the ED. Should you have to go to the emergency department, we can call and say, hey, I just spoke to so-and-so's daughter, we have a bed secured. Once you do the workup, please send me the referral, and we get you over to us as soon as possible.
It's got to be rewarding to see someone come in on their worst day
Yes.
and go out on
Yep.
what was probably going to be one of their better days.
Yep, so unfortunately we do see patients when they are admitted at their worst. Their behaviors are at the extreme. Sometimes they're coming from an ED. So they come in really out of control. And that's very difficult for not only the patient, but the staff. As quickly as we can safely stabilize them. And then before you know it, they're having conversations with you. You're reminiscing. They're participating in trivia, painting nails. So it's amazing to see how on day 1 it was out of control, and then here we are day 20, and they're who they are.
Yeah.
They're grandma, grandpa, mom, dad.
All right, if you would like more information on the Geriatric Behavioral Health Hospital at Masonicare in Wallingford, please head to their website. It's masonicare.org.